Hello. Good afternoon, everyone. This is Sister Maggie Whitman from the Home Assembly Church, registered nurse and the leader of our team for healthcare ministry. And we are very excited to come to you today to share with you a very special guest speaker and deal with the issues that are going forth with COVID-19 and the vaccines. We just want to have a chance to share information and let people ask questions and share their concerns. So most of you know my background. I'm a nurse at Miller's and Children's Hospital, Women's and Children's Hospital, and I've been a nurse for 24 years. Michelle, who is my partner in our healthcare ministry, actually graduated with me at the same time from USC in 1996. She's our special public health nurse who's an asset to our team, and I'm going to introduce her next, and she will be introducing our speaker, Dr. Tracy Veal, and giving you a little background on her. Stay tuned with us. We hope you enjoy this session. And Sister Michelle.
Well, praise the Lord, everyone, and thank you for tuning in. I am here to give you a special introduction of Dr. Tracy Veal. Dr. Tracy Veal currently directs the COVID vaccine collaboration for equitable distribution on behalf of Los Angeles County Department of Public Health, to which I am also a public health nurse employed. She has over 3 decades of experience in all aspects of healthcare. She's been a provider, a community collaborative. She's based pharmaceutical, clinical equity management, hospital administration. She is an experienced leader in Medicare, Medicaid, and commercial health plans. She is also national and internationally experienced collaborating with communities and corporations for chronic diseases and interventions, disaster management, operations management. What can I not say about this phenomenal woman? I want you to help me welcome Dr. Tracy Veal. There's no question that is a stupid question. She's so welcoming and understanding. So at this point, I will turn it over to her.
Oh, thank you so much. And thank you all for taking this time today. I know you're hearing a lot about vaccines and what's going on. So this is your opportunity to ask me whatever you think. And again, no question is too dumb or too small or not important. It's all about you today. So what I'm going to do is I'll give you a little bit of background on the vaccine, and then we'll talk about some of the commonly asked questions. And I will pause to give you a chance to either put a question in the chat or to ask your questions. So you can type your questions in the comments section on the screen, on the right of your screen, and we'll take those as we can, okay? So why don't we get started? We'll put the slide presentation on the screen, and we'll move forward with just letting you ask questions once I get started. So again, I'm Dr. Tracy Veal. I had colleagues who helped put this presentation together. And one of them, Dr. Shabita, is actually at the forum working today giving vaccination, so she's not here. But we also had input from Michelle, who's our public health nurse, and she also works for the Department of Public Health in LA County. So we appreciate that. So let's move forward to the next slide. I do have a little bit of a disclaimer because as we look forward, every time we look, the information is changing. So information about the vaccine changes so frequently. This is current as of literally the last 24 hours. And the approved vaccines made by Pfizer Moderna will be described, but we will also talk about Johnson & Johnson. And we have that on pause right now, and we'll talk about the why and the what. And if you want any information about vaccines, there are 2 links in this slide presentation that will be distributed afterwards that you can click on and find out anything you need to know about the vaccines, okay? So let's go to the next slide. I would be remiss if I didn't mention the fact that we know racism has impacted the vaccine and the distribution of it. And I want to acknowledge and respect that there are legitimate concerns around the history of Blacks and people of color in the medical establishment. So before we go forward, I just want to acknowledge that. And part of why I work so closely with the communities is to let people have a voice in how we approach things and help us self-correct some of the issues that have been part of our history and legacy, as well as some of the things that have happened with the vaccine. And we also want to make sure that the information we give you is from people you trust and know will tell you the truth. So that's just the fundamentals. And I'll go to the next slide. So this interview, overview will give you a little bit about how the vaccines work. I've heard a lot of verbiage around DNA. And so we want to talk about where does DNA play in this, how these vaccines were developed, because the majority of the development of the vaccines were done by people of color or immigrants. And also the safety, since that's a common concern, what you should know about getting the vaccines and any type of myths and scams and where you can get more information. Okay, so those are some of the things we'll discuss today. If we go to the next slide, I'll go with the commonly asked questions. But before we go there, I want you to know how the virus has impacted LA County. You may already know this, but I just want to make sure you look at the screen and see that when you look at the race and ethnicity, the death rate is really high of people of color, the brown and the Black people. And you look at the Hispanic and Latinos, you see these high numbers, and you see the Blacks and African Americans, and you see these high numbers of who's passed away because of it. So that's really one of the sad things that we see. And in February, every 6 minutes, a person of color, January, February, into December, a person of color every 6 minutes was dying of COVID in LA County. And it was a really devastating time. So moving forward, why we think the vaccine is important is because it keeps people out of the hospital and keeps people from dying no matter which vaccine you get. So we'd never want to see these numbers again. The other part is the lower the income, the higher the possibility of death. So we want to make sure that we take care of people who are more vulnerable than others. So that's just the facts around what's happened with the vaccine. And yes, people are not in the hospitals as much, but the people in the hospital now are younger people. So it's very alarming to us. So if you go to the next slide, I'll stop and take any questions or comments if there's anything in the chat, but I'll move forward because when you see these maps, those maps that show this dark blue on the screen, when I look at what area is this is South LA. And then I see areas like Pacoima, and then I see areas like Palmdale, Lancaster. And it's the brown and the Black people that are in the darker shades of blue. So part of what we're doing is making sure we send vaccines to those areas by mobile clinics or other places where people tend to go. So churches are a key place where we do have vaccines. So we can take a question from Ms. Vernetta, even though it may be detailed, and we'll go to the next slide. Your question is, how much information is there about the vaccine in the teenage population? So let me say a couple of things about the vaccine. There is only one vaccine right now that is approved for people who are 16 years old, and that's the Pfizer vaccine. The other vaccines are in studies right now to gain approval. So that any place you go that has the Pfizer vaccine, someone 16 years or older can get that vaccine. And so if you need to know where is the Pfizer vaccine being made available, a lot of the churches do have it. And on the website, it tells you which locations have the vaccine that's Pfizer. Kedron Health Center in South LA has the Pfizer and other vaccines as well as the Forum in Inglewood has the Pfizer vaccine. And others are ramping up to have more Pfizer vaccine to account for the 16-year-olds. I don't know if that fully answers the question or not. Okay, let's go to the next slide. If I didn't, I'll come back. What we know about COVID, I know you've heard a lot about it. One of the most frightening things for some people is some people get mild symptoms when they have COVID. Some people don't hardly have any symptoms. But what we do know is those who get the most severe initially were likely to be older and have certain conditions like diabetes or heart conditions. So it really ran rampant in the communities of color because we have more people with some of these diseases. And the interesting thing is the vaccines were tested on people with some of these chronic diseases, but the type of symptoms also varied. I've had at least 10 people in my family who had COVID, and some people lost their sense of smell. Other people had diarrhea or stomach aches. Other people had nothing. So it just varies from person to person. And that's why you can pass the virus even if you don't have symptoms. And a lot of people think once they get the vaccine, they don't need to wear the mask anymore. The problem is you don't know who has what, and you don't know who's gotten the vaccine or if it's effective yet, if you haven't had the vaccine for 2 weeks. So this is what we know today about COVID. And as we're moving forward, things might change, but this is what we know today. So if you go to the next slide, I'll pause and allow you to ask any questions. But basically, at the end of the day, it's like the vaccine saved lives. Not so much which one you get, it's getting one to begin with. And one of the more pressing concerns that those of us who are in public health have is that in areas that are Black and Brown people, the vaccine tends to take a much more aggressive course, because in smaller communities, it may infect 2 or 3 people for every 1 person that is getting COVID. In our communities, it tends to double or quadruple that because we are multi-generational families. We also live in closer contact, and we also are those people who have to go out and work. We may not be working from home. So we advise people to get the vaccine no matter what it is, because it's going to save your life and hopefully keep you out, and will keep you out of ICU, as opposed to what's happening with COVID in the Black communities, where people are waiting till they feel badly, they get sick, they're in the hospital, or they pass away rather quickly or over a period of time. So they protect us, they protect our family, the vaccines protect our communities. And at the end of the day, the vaccine, the risk of the vaccine will outweigh the benefits of death or ICU hospitalization or long-term impact. So that's why we advocate for people to get the vaccine. However, part of what we're doing today is educating you or giving you as much information as we can, because we want you and your families to make an informed decision about the vaccine. So I'll pause right there if there are any other questions and go to the next slide. I don't know if there's other questions in the chat or not. Okay, so Vernetta said her son received the first shot, but you were skeptical for his age group and you're a Delta. Many members want to know how to ensure appointments for the elderly, and you service Pasadena and surrounding areas. So a couple of things about how to ensure appointments for the elderly. I have been with a lot of younger people who took their iPads and are setting aside time on their phones to help us get appointments for older people. And one of the things that we've done privately, because we saw that some of our large sites were, what, for lack of a better word, corrupted by people who were outside of those communities, and people in the communities couldn't get access. So we have what we call private appointments. And what I mean by that is if you really cannot get an appointment for an elderly person in those surrounding communities, we are here to help you get that appointment. We have a set aside on Friday just for private appointments at places like the Forum. We also have transportation vouchers, and we have volunteers who are helping people get appointments at pharmacies and other places that are closer to their home. In addition to that, one of the reasons why we're doing the churches is to ensure that there is a place where there are trusted people that you feel comfortable with. And we have a calendar of all of those churches in the areas that are having vaccine sites. So that's how we are able to help. And if you service Pasadena, Pasadena does have its own health department, and we can link you to that one as well. Okay. So if you go to another question, how does the vaccine affect those who are pregnant or who are planning to get pregnant? We've heard a lot of rumors about infertility. We have no science, no research that has indicated that the viruses, the vaccines cause infertility at all. There is not a single case thus far of that. And as far as how does the vaccine affect those who are pregnant, we ask that people have a conversation with their physician if you are already pregnant. And some people have decided to get the vaccine because obviously a mother will worries about passing things on to her kid. So we do have quite a number of pregnant women who made a decision to get the vaccine. We have a small number who have not. And right now we're not finding that it has had an effect on those who are pregnant in terms of symptomology or anything different from the broader community. We have not had a single case of impact on a pregnant woman. So we tell women to have that discussion with your doctor to decide what you're comfortable with, because you may want to know more details. Like we have people who want to know exactly what are the contents of the vaccine. We have the detail around that if they're wanting to know very explicit detail around the impact of the vaccine long term. We have that information too. So it's up to the woman to make that call. But for the most part, we've had a significant number of pregnant women taking the vaccine. And we have an entire summary of information on pregnancy and the vaccine that I can send afterwards as well to distribute. Okay. Okay, we'll go to the next slide, and then I'll pause after a few slides and take questions again. So if we go to the next slide, this part about how do the vaccine work? We've heard a lot of rumors about how it works, but I'll try to be as simple as possible. So basically, the vaccines prepare your body almost like to be in a war against when the COVID virus would enter your body. So your immune system, once you get the vaccine, it takes about 2 weeks for it to fully activate, but it basically is activating to fight against COVID if it comes into your system. So once you get that vaccine, it takes about 2 weeks for it to get through your entire system. And then it literally creates a response to anything that looks like COVID. So if COVID enters your body, it fights it off. This vaccine is not COVID being injected into your body. It is not. These vaccines were made in a laboratory, and they are not us taking the COVID and inject it into your body. So we do not inject COVID into these vaccines. There is not a COVID material in the vaccine. What it does do is it artificially creates a defense protein that will go up against COVID if it comes into your body. These antibodies it makes prepares your body. It has a memory. It's like those of us who've had challenges losing weight. They say fat cells have a memory. Well, these cells have a memory. And if COVID enters your body, it's going to have a defense against COVID that will respond to COVID coming into your body. And it will literally fight it off so you don't go into ICU and you don't pass away. So it has a long memory. And after getting the vaccine, if you are exposed to COVID, it remembers, it has a memory. It remembers to fight it so you don't become as sick and pass away. So that's the way the vaccine works in terms of your body. But there is we're not injecting you with COVID, contrary to, I've heard a lot about that, and that's not how this vaccine works. So I'll pause there and go to the next slide and see if there's other questions. Okay. We'll go to the next slide. And these vaccines, the Pfizer and Moderna vaccine, and Moderna is the one that you've seen a lot because that was led by a Black female physician. And the truth is these vaccines were in development over a decade, 10 to 15 years. So it's not this overnight thing people think. But these two vaccines, Pfizer and Moderna, are what we call messenger vaccines. And what that means is they literally send that signal to build up the defense. And if you could imagine visually having to blow bubbles, there's a bubble and the particles are inside of that bubble. And once it gets into your body, it's released into the memory of your body to fight off if COVID comes. So it's like having your own little military force in your body that will protect you if you get exposed. It only responds if there is COVID that comes into your body and it reacts. But other than that, it stays kind of dormant and quiet until a COVID virus enters your body. And these two vaccines, Moderna and Pfizer, that is how they operate. And that's why they're called messenger vaccines, because they literally message the response to your system. And it's not DNA that it does. It does not change your DNA. The acronym here is mRNA, which is the messenger response to any kind of COVID that comes into your body, but it's not DNA. It does not alter your DNA. So over time, these vaccines would have to have a booster of some sort as new variants come out, because it does not stay in your body for the rest of your life. Over time, it's like the flu shot or other things. It is going to dissipate. That's why we know it does not change your DNA. So if you go to the next slide. So these two vaccines, we hear a lot about, I want one versus the other. And I tell people, take whatever you can get, because it's really critical to get a vaccine. So if you look at these two, both of these are equally effective against preventing you from going into ICU or passing away. The difference is Pfizer was actually tested on a younger population. That's why people age 16 can get this vaccine. Others are in development, and they may release information saying they will also allow them to be given to people who are younger. But right now, the Pfizer vaccine is for 16 and older, and the Moderna is got a different age group because that's who it was originally tested on. Both require 2 doses. There's a difference in the timing of when they tested these, how far apart, but both you have to have 2 doses. And the reason is the first dose kind of alerts the immune system, and it gives you a measure of protection. You get that second dose, and that measure of protection goes up to 90+%. If you just had that first dose, it only gets you partial of the way there. That second dose boosts your immune system up to such a high rate. Because even the flu shot, what people don't know, there's so many variant strains of flu that if you get the flu shot, it's only maybe 50 to 60% effective. This rate of effectiveness is that second dose boosting up that first one. So it's just important to get the same brand of the vaccine for both doses, just so you have these rates that they're saying are the highest effective that you can. Yes, other countries may be mixing. We're not doing that in the US. We want the highest effective rate we can get. So I'll pause there and see if there's questions before we go to the next slide. The question in the chat is, are the appointments in LA available for those who don't reside in LA County? And I would tell you, no, not necessarily. Even if you don't reside in LA County, but you work in LA County, you may be able to get the vaccine if you work here, if you have proof of working here. But if you don't reside, they ask that you go to the county you reside in. And the reason for that is the allocation of vaccines was so limited that we got an allocation based on residency, not on the employees in the area. So hopefully that helps. As far as issues with the COVID vaccine and the flu vaccine, no, there has not been issues. In fact, this is one of the lowest rates of flu we've had in the United States in a while. And we think it is for several reasons. One is because people wore masks and people washed their hands and they didn't congregate together. So there haven't been any issues with the COVID vaccine and getting the flu vaccine. Most of the doctors and myself, we've gotten both, but we do try to put those apart, meaning not necessarily get them in the same date, only because some of us get tired when we get the COVID vaccine initially, and we don't want to also be overly tired from having both at the same time. But there have not been any issues with getting them both. They just usually say, try not to get them the same day necessarily, but still get both, okay? Because one fights something different. And then the next question I have is, if a church wanted to be a vaccine site, there is an evaluation that we do go over logistics and the feasibility. So there's a checklist that we provide to you on whether or not your church is suited, because in addition to certain social distance requirements, there are some other logistics that you may decide you don't want to do it on your site because you have to do some promotion and open up your church to the community, and others have decided they want to do the vaccine site with several other churches to take the burden off of promoting and outreaching. So I'll provide that I'll provide that after the call as well. I'll send the information about the vaccine site requirements. Okay, we'll go to the next slide. The next slide is, I get a lot of questions about, some people feel great after the vaccine, other people don't feel well. What is the deal with that? So what we found that's interesting is Some may get some side effects after the second dose. Seems to be where we hear more people complain, particularly younger people. The older people in general have told me they didn't feel a whole lot. They didn't have any fever. Some of the younger people have complained about headaches, feeling tired. Other people have said, you know, I know my arm was a little sore. I just put a patch on it and took some aspirin every 4 to 6 hours afterwards, and it kind of dissipated. But other people said their arms might have been red at times, and I've heard that from some people with the Moderna vaccine. But there's variation. Like I said, younger people tended to complain or say there is more problems. Not to say the older people didn't have this, but it seems the younger people had more common muscle aches and headaches. But across the spectrum, it varies from person to person. And some people were worried that didn't get any side effects, saying, did it work? And yes, it does still work. It varies from person to person. The side effects can actually be an indicator that you're having a good immune response. And I know quite a few people who had COVID already said that they felt like they had milder side effects. Some of them said worse, but they said it was nothing like when they had COVID. So at the end of the day, it's really important to realize it might be some minor adjustment for a day or two or a few days, but compared to what you have to undergo when you have COVID and the risk of being in an ICU and passing away and or having long-term effects from COVID, it's worth, many people have said it's worth what you experience, even if you have any of these minor impacts. So you also need to make sure you return to the second dose, even if you don't want to, because it varies. The most I've seen is you might have a little bit more of a sore arm or maybe a mild headache for some people, but others said they didn't get anything. So it's still worth these symptoms versus what people who have experienced COVID, at least those of us who witnessed it up close and personal, have seen. So that's just a virus combat that your system is going through to try to protect you. Okay, so I'll go to the next slide. And again, we talked about some of the reasons why people didn't feel well. There's a couple of questions that I always get about, can you still get COVID if you got the vaccine? And what we found is the people who did get COVID and had just gotten the vaccine, some of them were already infected with COVID before they got the vaccine and didn't know they had it. Others, I've seen people who literally take off the face mask as soon as they get the vaccine and they're out doing their normal. And that put them at more risk. So before the vaccine had its 2 weeks protection, they were already incubated with COVID because of various reasons. But by and large, this does protect you. But if you already had COVID incubating, you could possibly feel COVID, but it still protected people who had COVID from going into the ICU and passing away. So they said they all wondered what it would have been like had they not had the vaccine. So the best protection is don't think you're in the clear until at least a couple of weeks after that second dose. And even then, because you don't know who you're going to be around, what strains are out there, we still tell people to try to keep washing their hands and wearing that mask until we get everybody vaccinated as much as we can. Okay. So I'll go to the next slide. And the natural immunity, we hear that we don't know how long the vaccine will last because there's a lot of new variants, but for now we're assuming it will last at least 6 months to a year, and we might have to do a booster shot for you, just like flu shots, because there's all these variants coming out because this vaccine has really hit so many people. And normally vaccines don't mutate and have new variants, but when you have such large populations getting infected, it happens that way. So we do know that there have been people who've gotten COVID more than once. Those people had not had the vaccine. And if you get COVID, you could get very sick. So if you feel okay and you don't know you have it, you can give it to people. So we tell people every moment matters. Get the vaccine as soon as you can, because it's just a safer way to protect yourself, your family, and your community from having COVID, and the impact it can be very devastating, not just short term, but long term. It can impact people's heart and other organs over time, even a healthy athlete. So we say try to avoid getting COVID as much as you can. Okay. I'll go to the next slide and see if there's any other questions or comments in the chat. How long will the vaccine last in our bodies before we need to get booster shots? So that's the one question with all these variants out. We were looking at least a year or at a minimum 6 months. So at least a year, we're thinking the shots will last, and then we'll have some vaccine adjustments, meaning booster shots that may come out against the new strains. The newer strain, the Johnson & Johnson vaccine, was in development when some of the new strains came out. So they did formulate against some of the newer strains, but the other vaccines that are currently out are also being reformulated for booster shots in the future. So next year, we will probably have more booster shots that can combat all the new strains that are coming out, okay? And most of them currently work against the basic strains that are coming out. Is the Brazilian strain that is being tested right now to see the effectiveness, and the South African strain that are being tested. But there are still, the vaccines still provide coverage against some of the other variants. As far as African American participation in the vaccine trials, there has been participation. In fact, for the first time, that was participation in all of the vaccines of people of color and also chronic diseases and ages. They just didn't test in younger kids. And so what is happening now, as they're creating the boosters, they are doing outreach to even expand that participation, because traditionally African Americans participated lower in the clinical trials for a variety of reasons. There's mistrust. There's also recruitment that missed out on really engaging the Black community, academics, and physicians of color. And now that has been changed. So they are leveraging everything from alignment with historically Black colleges to research with universities like Morehouse, and also even in some of the communities, churches and other community-based organizations are helping support increasing Black participation in the COVID studies for the vaccine and even the boosters right now, okay? So let's go to the next slide. And I'll talk about, people thought it was just really fast how quickly these vaccines were made. My colleagues who are scientists were a little upset by that, because they worked on the vaccines for 10 to 15 years, and we had a head start, because similar viruses like Ebola and other types of viruses that were out there were being studied and researched. So the recipe, so to speak, for these vaccines had been in development, with doctors and companies working around the clock, supported by funding from a lot of different sources, and existing collaborations and coalitions were at work for the vaccine before it was ever even released to the public that vaccines were in development. And one of the interesting things about COVID around the world, I have colleagues in everywhere from Japan to Canada. They shared a lot of that research initially. So the recipe for creating the vaccines was shared across the world to try to get it to market fast. But for over 10 to 15 years, the work was being done on this vaccine. And every step that was required to make sure it was safe was followed. There were no skip steps or anything. The only thing that was done that was different was just to have vaccine ready. There were batches that were created before it was totally released, just to make sure it would be ready. But beyond that, there was nothing else that was done that cut corners or did anything different. In fact, some people thought some of the work that's being done right now is much more robust than prior vaccines, because there are committees that were not just the federal government. The National Medical Association, which represents Black physicians, had its own convening to research and oversee the testing and the vaccine research. The state of California and the Western states had another convening of experts and lay people who also oversaw the research that was done to make sure it was safe. So there was a lot of different layers of people looking at all the research to make sure it was safe and effective. Let's go to the next slide, and I'll see if there's any other questions in the chat. Okay. In light of the pause about J&J, what booster may be available for those who received the J&J vaccine? There will be if they do make a booster for J&J, it will be a variation of what's currently existing. And J&J is paused for now, and there's a week still left before they will reconvene to discuss expanding it. They will make a booster that will be compatible with J&J if that is what the need is. So even though there is a pause, that was already in development as well. So again, I think I mentioned earlier about manufacturing that there were no shortcuts. Manufacturing began when the clinical trials were still underway, so they could be ready for it. But when any adjustments were made, they literally had to redo the batches every time, but they were willing to do that just so that we could have the vaccine ready to go. And the FDA and the Centers for Disease Control had a lot of reviews for this, and they have public hearings so you can actually see and hear what they're reviewing. So there were no secrets and everything was transparent. And the safety standards were same as, I think they were actually more stringent because you have multiple layers of entities reviewing the safety data on an ongoing basis, including J&J. So if you go to the next slide, I'll take any other questions after this. There's a lot of studies around Pfizer, Moderna, and J&J. And the Pfizer and Moderna vaccines were studied in over 70,000 volunteers. Half got the vaccine and half got salt water, which we call a placebo. And they were tested, as I said earlier, in a lot of different types of people, in older adults and communities of color. Right now, what's going on is there are vaccine studies in kids and teenagers below the age of 16, and that's going on very assertively and aggressively just to make sure that we can create a vaccine for kids who are under the age that the vaccine was tested in. So both of these vaccines, Pfizer and Moderna, were considered effective and they worked well, equally safe for all of the different populations that were served. If you go to the next slide, as far as that, like again, I said there were no shortcuts. There was a lot of independent panels outside of just the government entities. So if you go to the next slide, and I'll see the safety is such a priority that after these vaccines were authorized, there's extra monitoring. So if you go to a vaccine site in LA County, you'll get a sheet of paper once you are sitting there for your 15-minute observation, and they will ask you if you want to sign up for a thing called Be Safe. And what that is it's a text app where you can say, I had a headache today, or I had a symptom, and that's how we're keeping up with the symptoms and who has what. And there's also a telephonic opportunity and another app that is used. So you have the option of reporting your symptomology. It is not mandatory, but we're asking people to participate in that so we can see if there are differences between ethnic groups or ages or types. And that's how when the Johnson & Johnson pause happened, those data systems were the ones that we used to determine who the people were that had been impacted, primarily women, primarily Caucasian women that were ages 18 to 48. There were 6 cases that were reported. And we know a lot of detail about those cases because of the follow-up that was being done through these different mechanisms for symptoms and follow-up from having gotten the vaccine. So that's why it was so fast and swift when a lot of media around it, but it's because the diligence with any type of symptoms are being tracked if you participate in these is pretty robust. I'll go to the next slide and see if there's any other questions in the chat, because I know this is a hot topic, the Johnson & Johnson vaccine. So I want to make sure, what can you do as a member of a Black service organization to help in the vaccine efforts? In addition to sharing this presentation, we expanded what we call community ambassadors, which are volunteers. And the churches have been really good about using this training that I'll share with you at the end of the presentation. And it's basically to learn more about the vaccines as a layperson, so that you can get alerts and all kinds of communication to just be a trusted messenger with information that's accurate as opposed to misinformation. And that's where, whether it's a sorority or a fraternity or a community organization or a church, where you could be invaluable to the community, because getting accurate information, particularly in the era of social media, has been a challenge in the Black community and communities at large. So that's where I think people can be really helpful, and we're willing to share that information and the ambassador program information with you. So let's talk about Johnson & Johnson. Since last week, it's been the hot topic. So it's 1-dose vaccine. It was approved for people who are 18 and older, and also keeps people from being hospitalized and dying of COVID. Instead of using that messenger process that I showed you, it's a little different. It uses a cold virus, and I mean like when you catch a cold, that's the kind of virus that's used to deliver the instructions. So instead of the bubble that I described that has a protein in it that goes into your body, it uses an actual cold virus, not a COVID virus, because people are like, are you injecting people with COVID? No, we're not. So this is a little different in terms of what encapsulates the message information to get to your body to fight COVID. But it basically, once it's inside, it also sends a signal to uniquely identify anything that says it's COVID. It can identify that virus, and it will put up the defense, the war, the military in your body. The proteins come together and they will fight off that virus. So it gives instructions just in a different way, in a different thing. Instead of that bubble that I talked about, it's a little bit different from that, but it still does the same thing. It sends a signal, and then your body produces the fight mechanism, and it has that memory in your body, so that if the COVID virus crosses your body, it will fight that virus. So if you are infected, it stops it from really getting to a point where you have to go into the ICU and you may possibly pass away. And the reason why that vaccine was placed on a brief pause on April the 13th last week was they wanted to be extra sure that those 6 women between 18 and 48, that it was just those 6 women. And right now, that's all they're showing. And it's a rare type of blood clot that manifested itself in these women. And they're trying to see what commonalities those women have outside of just, okay, there's these 6 women, primarily Caucasian, those age groups. They're trying to identify if there's something else underlying. And they may decide that maybe a certain type of female may not get this vaccine, or they may pivot and say it's okay, but look for other reasons to still use that vaccine, but maybe use it differently. We don't know yet until they have that committee convening next week. So I'll pause there to see if there's other questions about J&J. Okay, the question is, if one had COVID infection and was treated, why should I receive the vaccine? So that's a common question that we get. If you have had COVID and you were treated, you should get the vaccine for a couple of reasons. One is there's new variants that the majority of the vaccines that are out and about can help prevent. The second one is if you get the COVID infection a second time, it could be even harsher than when you got it the first time or not. You don't want to take the risk and go into ICU again if you were in there, or to get it again and go to ICU or have the risk of death. So the second infections can still be deadly, even if you've had a COVID infection before. And I do know a number of people who had it and got it a second time. And we're trying to see if there are people who are even at risk of getting it a third time, because it's risky enough, but having that vaccine keeps a person from passing away. So I hopefully that helps. Okay, we'll go to the next slide. When, where, and how can you get the vaccine? If you're having challenges getting the vaccine, I will leave my information in the with the team here, because we want to help people get the vaccine, particularly in the Black community and the brown communities where the virus had its most devastating effect. So it's available to everyone, as everybody knows, but it's hard to get, right? It's free. So if somebody's trying to charge you, don't take it. It's probably a scam. There are a couple of ways. One of the things that my husband was doing for people was helping them get vaccine appointments through the pharmacy. The problem with the pharmacy, some people say, is you absolutely have to have a vaccine appointment, and it's hard to get those slots. Other hospitals are doing it. There's these big mega sites. There's community clinics. There's local churches, and we get politicians and others who sponsor these pop-up sites that we try to distribute information about. And so we have an entire spectrum of sites to go to. But if you're having a problem getting a site and getting an appointment, we have this link here called vaccinatelacounty.com. But if you still are having problems, you let us know and we'll help get a navigator to help you. And that's where those community ambassadors help us get people everything from transportation to appointments, and we have resources to help get that done. Okay. So if I go to the next slide, just a few last things. This is a map that's interesting, that's hard to read, but basically what we saw was there's a lot of different sites that people had access to, but when we looked in South LA, it wasn't as detailed in terms of the options, which is why we suggested engaging the church community to really fill some of those gaps where there's just not enough sites and access. So that's part of why we're supporting some of the churches having vaccine sites, because there really literally weren't enough doctors and pharmacists in some of these communities to help support getting the vaccine quick enough. Because if you go to some of those mega sites, until recently, there was no walk-up opportunity. You had to have a car, you had to get to the sites, then appointments were hard to get. So we were trying to make it easier to go where people need the vaccine the most. Okay, go to the next slide. That was a question that came up. I think I addressed about if you already had COVID-19, it is still recommended, because having COVID only protects you for a short period of time. And we do ask what date you had COVID if you've had COVID, because we usually wait till after people have symptoms, 14 days after they have their last symptoms, or those who were attached to a what we call the golden serum bag, meaning you got antibody treatment for COVID. We don't want to see you have any interactions with the vaccine. So those people, which is a small number, we tell them to wait 90 days. But anyone else within 14 days to 30 days after they've had COVID, we want them to get the COVID vaccine as soon as they can. Okay. Let's go to the next slide and see if there's other questions. The pregnancy and breastfeeding, I just wanted to recap that although these studies for the vaccines did not initially include women who are pregnant or breastfeeding, we haven't had any, we have been monitoring women who are pregnant that have been getting the COVID vaccine. And there are quite a number of women who are essential workers, from doctors to frontline people who were in restaurants and others, that felt that it was better for them to get the vaccine than to stay at risk. So we really tell people to, women, to discuss it with their doctor if they are hesitant about getting vaccinated, because they want to see if the risk is worth it. But this is really critical in terms of pregnant women who could be exposed to COVID. So I'll go to the next slide and answer the question. Is it important to know the source or strain of COVID contacted? Absolutely. It is. It's not necessarily important to know the strain, because what happens is the Department of Public Health takes samples of all the different testing and COVID results that happen, and they evaluate what strain it is. So you don't necessarily need to know, because we are trying to track everything from the zip codes that we see different strains to the type of people that are getting different strains. For example, a lot of kids that were in Florida at the beach, that we saw pictures of all of that. We literally, there's literally tracking going on to see where strains some of those kids that have ended up with COVID are having, and who else it might be impacting, what states did they go back to, that sort of thing. So we can see where the migration of the virus strains are happening. That's how we know where there's 5 or 6 strains and what strains there are, because we're tracking those strains by looking at the test. And if they didn't get a test when people are hospitalized or have other issues. Okay. If you go to the next slide, we'll see if there are some other questions. There's a lot of people who may have had everything from cancers to other conditions that may have weakened their immune systems. And although these folks were not included necessarily in the trials, they are being evaluated currently. We don't know how well the vaccine will work on some people, depending on the type of immunosuppression they have, but they are at such higher risk. And I do know one politician who was a breast cancer survivor who had just gotten the vaccine, and she ended up with COVID. And she was a Black female politician, and she said what was interesting is one of her colleagues also, who had been in her cohort of people with cancer, also got COVID, didn't get the vaccine. That person was in the hospital. She said hers was more like a mild cold. So that weak immune system can benefit from having COVID, because she says she always wonders if she hadn't had that vaccine, what it would have been like. And we also didn't include people in initial studies with HIV, but so far have found that it's safe and effective for people with HIV, and we recommend, because their immune systems, depending on the type of immune system they have and their conditions, is also beneficial, because they're at higher risk for getting COVID. Okay, go to the next slide, and I will pause for any other questions in the chat. We have questions about allergies and severe allergic reactions. I have quite a few people who have asthma and other conditions in my family, so this was a concern. And basically, we provide the information on what's in each one of the vaccines. None of them contain certain things like salt, sugar, and other things. But I know one person who had a reaction to having the colonoscopy fluids made her sick. So she looked to see if that was a match, and her physician helped look at all of the listings of ingredients to see. So if you think there is a risk of getting a reaction from something, you can talk it over with a medical professional. But what we've seen so far, there is a small risk, but we have people on hand at every single vaccine site that have the reactive medication should you get a reaction, which is why we ask people to wait 15 minutes after they just got the vaccine to wait on site. And we also ask that you use one of those systems that we use to track symptoms. So if you do think you're having something, we can quickly report that and make decisions around it. And also, as far as allergic reaction, people who've had allergic reactions to this particular polyethylene glycol or polysorbate, which is an ingredient, should also talk to their doctor. They can assess the risk. But we haven't really had a lot of reactions at all. But we do have people on site with everything from A to Z to respond should a person have an allergic reaction on site. And people who are allergic to other things, I had people call about they're allergic to pets or pollen, or they can be vaccinated. There doesn't seem to be any reactions to those types of things. And if you really are concerned about it, and our information is being updated as more people are getting the vaccine, there is a link to a site here. And then I had a question about what medication should be avoided before taking the COVID-19 vaccine, and for how long. Currently, we're not telling people not to take their medications before they get the vaccine. I can tell you that the one thing that is cautionary, people would say, I'm going to take my Tylenol or my aspirin before I get the vaccine, so that if I am going to have some soreness, I can avoid it by doing that. We tell people don't take anything before you take the vaccine, other than any prescribed medication like you would have for hypertension or anything else. But don't take the Tylenol or Advil or anything until after you've had the vaccine, just as a precautionary measure. We have not had reactions of any kind, but we'd rather you get the vaccine and take it, right after you've taken the vaccine instead of before, so that in case there is a reaction, we know it had nothing to do with that medication. But your prescription medications, you should still continue those. there aren't any medications. We ask that people don't ingest a lot of alcohol before they take the vaccine. That sounds standard, but we did have some young people who had nights out and took that vaccine the next day. And it wasn't that it was a reaction. It was really, you shouldn't really do anything after you've had over alcohol ingestion on any given day. So, okay, we'll go to the next slide. And if there's other questions, I'll wrap it up. Just some future concerns. We are concerned that people may not take the vaccine after hearing about some of the J&J concerns. And also because there's so much misinformation, we are very concerned, even amongst healthcare workers, particularly those in long-term care facilities. The lower level staff in the long-term care facilities seem to really not want to take the vaccine, which I know people will find ironic because there is a lot of death that happened in the facilities, but there was hesitancy because they were the first group that was offered the vaccine. We have had a lot more uptake, but we're concerned that those folks still aren't vaccinated, but the residents are. We are trying to meet people where they are. If you have questions, concerns, they're all valid. And we want to make sure we come to places where you trust to discuss this. And the most persuasive thing I've seen so far is when one family member or others get it, other people are likely to get it, and giving good information and people that you trust to give you that information. So our major concern right now is there's a lot of misinformation. We found some of it is what we call planted by other forces to try to keep people of color from getting the vaccine, which is really sad, but it's happened. So we tell people to take caution on social media when you see all of these things about the vaccine, because there's a trust issue with even who's planting misinformation. So I'll go to the next slide and wrap it up with other things that we don't know that are still learning about, how long the vaccines will protect us for. These vaccines were tested in a different point in time before we had over 500,000 lives lost. So, and the vaccines the vaccines are very helpful, but at the rate things are going in some states, not necessarily California, we're concerned about the vaccines being taken. And also the use in children is being studied now. So we don't have vaccines ready for kids yet. But if the family members get vaccinated, we know that helps protect the kids. And we're going to continue monitoring the vaccines to see if there's any like those rare side effects in the 6 women that we mentioned earlier. So let's go to the next slide and I'll see if there's other questions. Just the whole thing about beware of myths, some of the things that we've heard that aren't true are listed here, but we actually keep up with as much misinformation and talk about it as much as we can, because we heard originally that the Black and the brown communities are being singled out to get the vaccine. And now I've heard the opposite, where it's hard for them to get it. They weren't singled out to get the vaccine so much as that's where the devastation was happening. More people were dying. So my approach was to try to get it to the people who need it the most, to try to prevent more deaths and devastation. And it doesn't contain any dangerous chemicals, and it does not change your DNA, and it does not impact your fertility. And we don't inject the COVID virus in it to give people COVID. So like I said, my scientist friends are really upset that everybody thinks this was developed fast because they've been working on this a very long time. So if we go to the next, and I'll wrap this up and pause, just the scamming. If someone calls you, because my mother had calls from people saying they could get her this vaccine. And initially she gave me the number and she actually believed them, but that was not true. They told her they could give her a deal. And there are no miracle cures. I've seen people who paid $200 for tablets that were supposedly vitamins that would help them from getting vaccine, and it's a scam. We were able to get these people appointments for the vaccine, but they had already paid out money for this. And just report a scam. We are tracking them and we're intervening. And just don't post your picture of your vaccine card that shows your date of birth when you take a picture and you've gotten your vaccine, because there are people online that are looking for that information and have been able to get people's date of birth and full names by getting that information off the internet when they posted their vaccine card. Okay. I think that's it for me. If you go to the final couple of slides, just get reliable information. There's things you can sign up for. If you can't find what you need, I am providing my information to the church for anyone who's having any kind of challenges. We're here to help you. And these websites, everybody does not have internet. We understand that. So if you need to talk to a person, we will get you somebody, whether it's a COVID ambassador or someone from the Department of Public Health to help you, because we really want to make sure, particularly in the Black community, that people get what they need, because we have to stop the devastation of COVID. Okay. So if you go to the final slide, just continue to do these last few things. Wear your face covering. You don't know who's had the vaccine or not. Still wash your hands. Still, even though we've heard, oh, don't worry about the surfaces. My colleagues who work in the school systems are really worried about the surfaces because kids tend to touch and taste everything. So we still say disinfect to the extent possible, even though we know it's not something you have to do. We recommend it in our communities, and following any type of isolation and quarantine guidance if somebody in your family does get COVID. So I think that's it for me. If you go to the final slide, there's a phone number you can call. If you can't get through to that number, like I said, I left my email, and the church has my phone number too, so we'll get someone to help you. Okay, I think that's all I have. So thank you for taking the time. Okay.
Thank you so much, Dr. Veal. This was such a wonderful presentation. You hit the nail right on it, the heart and meat of everything that we've been hearing and needed to address. And thank you for answering all the questions. This has been wonderful. I'm so glad we will be able to share this beyond today. And again, we just thank and appreciate you so much, and for being a future resource for us and the church. Thank you, thank you, thank you. Sister Michelle, you want to say anything?
And to those in attendance, you can hit your share button and continue the conversation, because we all have a circle of influence, so people can make intelligent decisions, including what is faith-led. So hit the like, the share, the love, the tag, spread the word, and let's just continue the conversation so we can be healthy in this crazy, crazy, crazy time.
Yes.
Yes. Thank you all for joining us today. We appreciate it.
Okay. Well, take care.
Thank you.
Yay.
Yay.
Yay. Good.